So let's quickly look at different types of estrogen. You're going to get a low dosage form and a higher dosage form. Now, low dosage is anything between 15 and 35 micrograms, and this is usually when you want to use it for the indication of contraception. Then higher dosage form is going to be 50 grams and so on. So it's higher than 50 or around in that area. And then we're going to treat things like heavy bleeding, endometriosis. When you are on drugs that also induces enzymes, you're going to look at a high concentration of the estrogen. Important to know that if the patient is on a contraceptive, estrogen especially must be discontinued for at least a month before surgery and then for 2 weeks after surgery to prevent blood clot forming or so on during your surgery. Okay. Now, contraceptives should be stopped immediately when the patient is feeling any blood-related disorders, or she's having a migraine, or visual or severe headaches, and high blood pressure. So anything related with the blood and the cardiovascular system, and as well as the migraines. I forgot to mention migraine is also a contraindication when we are looking at estrogen. Okay. Drug interactions with contraception. Now this is very, very important. Antibiotics. Antibiotics have an influence on your vaginal and your gut flora. So there's sometimes they get or even the way that you metabolize your contraceptive, it has an effect on the ability and the efficacy of the contraceptive. So if your patient is taking antibiotics, you're going to want them to take additional precaution or abstain from sex for at least 7 days after the course of antibiotics is finished, and as well as during the course of antibiotics. But you have to tell your patients this. This is very important, guys. Also, interactions, drug interactions with drugs like efavirenz, rifampicin, your anticonvulsants. As we said, then you will need to go on a higher dose of estrogen to balance out that metabolic effects of the enzyme-inducing drugs. Okay, and then also laxatives. Okay, as well as when you vomit or you're having diarrhea, this can influence the efficacy of your contraceptive. So this is important. Now, when you get a new patient going to start on contraceptive, you always want to start them between day 1 and day 5 of the menstrual cycle. Day 1, we start counting when you start menstruating. Okay, then it will be immediately effective. If you started after day 5, patient is going to take 7 days precaution other than the contraceptive, and then it will also be effective. All right, and important, these tablets must be taken regularly. You can't decide morning, then the following day you take at night, then the following day you take in the afternoon. This is a serious thing, you can get pregnant, so you want to commit and you want to take it every day at the same time. Okay, this is sometimes difficult for patients, so you can advise alarm clocks or putting it next to the toothbrush or anything that can help them stick to a certain time of the day. All right, now let's talk about when you missed a dose. Now, a lot of patients go, oh, I missed a dose, am I going to get pregnant? If it's 1 dose, it's okay. You just take it when you remember and then you go on as usual. Okay. If it's 2 dosages, you might be more worried. She's going to take the last tablet as soon as she remembers, and then she's going to continue as usual. And then she's going to take precaution for 7 days. You can also suggest her to take then a morning after pill if she's really, really worried. So 1 day is okay, 2 days is a bit more worrisome. This is for your estrogen containing contraceptive, guys. Progesterone has a very smaller time frame that it's allowing. So there, I think like 2 hours or 3 hours. If you skip between the dosages, you're gonna have problems. But there's not a lot of progesterone only contraceptives, so I didn't go into much detail on them. Okay, I just wanted to give you the most relevant, most often used drugs to make this video as short as possible and to give you some information.